Your zip code may be more important to your health than your genetic code. Residents who live in a safe neighborhood with easy access to healthy food and routine destinations that they can walk to are probably healthier than residents living in a neighborhood without sidewalks or nearby grocery stores and have to drive everywhere. Clark County Public Health is studying ways to design communities to promote health. These include improving access to healthy foods and increasing opportunities for exercise. That's important in a county where 2/3 of adults are overweight or obese. Obesity leads to chronic diseases for many of these people. Public Health is working with community planning staff and the Public Health Advisory Council to draft a new element to Clark County's 20-year Comprehensive Growth Management Plan. If adopted, this health element, called Growing Healthier, would ensure that plans for future development are viewed through the lens of health.
The comp plan is a document that sets a vision on how the county and the community would like to grow. So it's the framework that guides us as to how we grow and develop as a community. A community that is healthy grows healthy, and there have been significant interest in the community to, yes, do a health element because our built environment impacts our health.
How a neighborhood is developed can affect the behavior of its residents. This built environment can promote health or create barriers to healthy choices. Factors that contribute to health include affordable housing, access to healthy foods, parks and open space, and infrastructure that encourages active transportation.
If you look at each one of those elements and apply it to the growth management plan, for instance, in terms of developing quality housing for folks, we want to lay over that the idea that health is important. So we have a walkable neighborhoods that are developed and housing that's more high density that allows people that are in those residents the ability to walk and get their groceries and walk to a park and have the ability to do something other than getting their automobiles to get places in the county.
In many areas of Clark County, people depend on cars to get around on a daily basis. Almost 1/3 of county residents are going outside the state to work. Statistics show that each additional hour of driving per day increases the odds of obesity by 6%, while walking just half a mile a day will decrease the chances by the same amount. People are much more likely to rely on their cars to get around if their neighborhoods lack active transportation infrastructure. These include sidewalks, bike paths, and pedestrian-friendly access to nearby transit, schools, or parks.
We can say to people, you need to exercise, but if you don't have a place to walk, you're not likely to go out and walk or get exercise. It's the same, we say eat healthy, buy fresh fruits and vegetables, but if you happen to live in certain parts of our county, you may not have a full-service grocery store available to you. And if you're a single mom with 2 kids and you have to take 2 buses to get to a grocery store to get healthy food, you might not be inclined to do that.
About 41% of Clark County residents live within a half mile of a convenience store or fast food restaurant, while only 17% live that close to a grocery market. If a health element is added to the comp plan, future development would incorporate healthy opportunities into the design. These include active transportation, parks, community gardens, and a mix of housing with nearby jobs and economic opportunities.
I think we all believe that people need to be accountable for their own health, that the fact that there's a lot of obesity within this country does come back to individual choices that we make, but it all comes back to this key question first off of whether or not you have the ability to make healthy choices. And what we see in many different parts of our community and certainly within the state is that people don't have access to be able to even make that healthy choice. There isn't necessarily any kind of structure or policy in place that would have the neighborhood convenience store have healthy vegetables, in their store. And those are all things that can be changed with, thoughtful policy going forward.
The Clark County Public Health Advisory Council and county staff will be presenting a draft of the Growing Healthier proposal to the public on April 10th at 4 p.m. in the Columbia Room of the new Vancouver Community Library. Staff will use citizen input to update the proposal that will be presented to the Planning Commission, followed by the Board of Commissioners. For more information on the Growing Healthier plan, visit the Clark County Public Health webpage at clark.wa.gov/public-health or call 397-8000.